Hi everyone, this is Dr. Benjamin Young at Intermountain Smiles. Today I want to show you a case of a patient who was having problems with a tooth that had a root canal that ended up being more than either of us expected. The tooth in question was her upper right first molar here. Here you can see the molar we're talking about with the root canal and the crown. Looking at the radiograph, there are a few things that stood out. There's a problem with the margin on the crown that you can see here. But I want to focus on some other things first. I could see a slight radiolucency or darkness at the apex of one of the roots. There's also a widening of the PDL space along the same root, which indicates some inflammation going on. A slightly different angle of the tooth shows a fairly large circular darkness, radiolucency right in the furcation area where the roots separate. So at this point there were a couple things going on through my mind, and just looking at this you wonder if the dentist who did this originally happened to perforate the root when placing the post, because it seems to go at a different angle than the root canal filling, which is up here. You can't be completely sure of this though with a two-dimensional x-ray, so the only way to know for sure would be to look at a cone beam scan of the area so we can see exactly what's going on. A cone beam scan is very similar to a CAT scan used in medicine. It allows us to see individual slices, so nothing is superimposed like on a traditional x-ray. It also creates a three-dimensional picture of the area in question. So here we have the cone beam scan, and this is the tooth that we were just looking at on the other x-ray image. The three windows give you different views of the same area. Right away you can see a much clearer indication that there's an abscess on one of the tips of the roots, which is a dark area that I'm indicating here. You can also see that dark circular area right where the roots separate. As I move through the area, you can see those dark areas around the roots, which indicate there's infection going on there. As I scan through a different direction, you start to see in the upper image the little white dots. These are the filling material that was placed when the root canal was done. As you pay attention to the white dot on the bottom right of the upper image, you start to see it disappear, and then a new white dot show up just to the left of where the original one was at. This is the post that was placed, and it does look like it wasn't placed right in the center, which contributed to the failure of this root canal and the abscess that formed where the roots separate. Ultimately, this tooth will need to be extracted as a result of the many problems facing it. The whole reason for this video, however, is to show you something I came across completely unrelated to the root canal. Back on the original x-ray image we were looking at, you can see that this patient has a dental implant, and by the looks of it on this image, it seems to be just fine. On the cone beam image, as I was looking at the different layers, I noticed that the implant seemed to be sticking out of her jaw near the top of it. I was totally surprised by this. When I looked in her mouth, I was able to feel the implant under her gums. Here, as I move through the different layers, you can see the white circle near the top of the image there that shows the implant, and in this bottom right image you can see the implant, and sure enough it's sticking out of her jawline there. Checking a couple of different angles, again you can see here in the bottom left image that the angle was not placed correctly, and so it's sticking out the side of her jaw there. Luckily she wasn't having any problems, and it had been there for quite a few years. She couldn't remember exactly when or who placed the implant, but this is a great example of why you need to have the right understanding and skill of implant placement to avoid this kind of thing from happening. I've placed many successful implants, and it's very surprising when you see something like this, because it should have been very clear to the dentist that something wasn't right when the implant was placed. So this is an interesting case, and I'll take good care of her to make sure she has a healthy, functional smile. This is Dr. Benjamin Young with Intermountain Smiles. Thanks for watching.